Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM from Houston, Texas. This is COVID-19 World News. The focus today is Johnson & Johnson COVID vaccine results update. Before I proceed into the feature presentation, I would like to invite you to take a look at my COVID-19 pandemic, an international guide available on Amazon.com, and you can also check my other publications. So let us begin with the feature presentation. Johnson & Johnson vaccine is unique in that it can be administered as a single dose. It requires normal refrigeration. It is able to produce 100 million doses by June. There are trials that have been ongoing in the United States, South Africa, and other places. So let's look at some of the preliminary reports from the Johnson & Johnson study. Johnson & Johnson COVID vaccine study, which involves a single dose which can be stored at room temperature. The overall efficacy at 28 days involving 44,325 patients was 66%. The study population in the United States showed a 72% reduction in the incidence of symptomatic coronavirus infection. In Latin America, it was a little bit less, 66%, and in South Africa, which has a variant of the COVID-19 virus, the efficacy was 57%. Even though some of these numbers look to be disappointing, rightfully so, the most important thing is that it reduced the severe diseases that need admission to the hospital or diseases that need intensive care unit, and these were reduced by 85%. So this is an important point as we look at worldwide pandemic of this COVID-19, which is just getting worse day by day. The overall results, as I said, may be less impressive compared to the Pfizer-BioNTech and Moderna messenger RNA vaccines. However, 85% reduction in severe disease and 100% reduction in hospitalizations are highly significant. After all, our aim is to prevent people from getting sick and going to the hospital and overburdening the healthcare system. Not so much about whether they test positive or negative. I mean, that is important, but those people who end up in the emergency room and who need admission are of a major concern, especially when our healthcare system has already been overburdened with the COVID pandemic. When we are in the midst of a pandemic, it is very important to reduce the number of infections, reduce the number of people spreading the infection, reduce the number of symptomatic patients, reduce hospitalizations, will greatly enhance our ability to get a control over this pandemic. And there are several other advantages. It is a single dose, so it's a lot easier to deal with large populations, and it requires minimal refrigeration. That means this can be transported to many distant places where a big investment in deep freezers may not be feasible. And here are some of the other important data. It can remain stable for 2 years at -4 degrees Fahrenheit and will remain stable for up to 3 months if kept between 36 degrees and 46 degrees Fahrenheit. So this is a vaccine that is ideal for rural places where they don't even have the facilities for a refrigerator or something like that. This vaccine can really fill in the gap in those areas to increase mass vaccination and, as I said, increase immunity in the community so that we reduce the number of hospitalizations and serious illnesses. A couple of points. The South African variant continues to be a challenge not only for Johnson & Johnson vaccine, but it is also so with the other major vaccines like Pfizer, BioNTech and Moderna, even though they have shown a better than 90% efficacy against the South African variant. But since the South African variant has already made its appearance in South Carolina and another state here in the United States, it will be of a concern to address this issue if the South African variant spreads far and wide. Johnson & Johnson research was in part supported by Operation Warp Speed. Johnson & Johnson plans to apply for EUA in February 2021. Ladies and gentlemen, this has been a very quick and brief update on Johnson & Johnson COVID-19 vaccine results. Before I conclude, I would like you to take a look at my book on COVID-19 pandemic, an international guide on Amazon.com. This has been a presentation of Triple N Media. I am Dr. NIK NIKAM from Houston, Texas, and please do subscribe to our channel. We will see you next time.